So Yuri, we've been asked to go evaluate a patient for decision-making capacity by one of our medical colleagues. But before we go and meet with them, I wanted to take a few minutes to review decisional capacity with you, explain a little bit about what it is and isn't, and then talk about the important things we're going to need to be thinking of while we're talking to our patient in order to help the medical team determine whether they have this capacity or not. So to begin with, like I said, I think it's important to understand what decisional capacity actually is and what it isn't. So it's fairly self-explanatory. We're really asking the question, does this person have the ability to make their own choices? And in particular, in regards to their medical care. One of the important things to keep in mind about capacity is that we, clinically and legally, presume people have capacity. We don't have to formally assess their capacity unless there's a question, a doubt, or some kind of a situation that makes the provider wonder if there might be something that's affecting this person's ability to make their own decisions. The other thing I think is really important to understand about decisional capacity is that it is point specific. It is a specific person, their ability to make a specific decision at a specific moment in time. And it can change over time. So someone may have decisional capacity at one point in time and not have it at another point. They may also have decisional capacity to make one type of decision, but not another type of decision. Clinically, we don't make the determination of whether somebody is unable to make any medical decisions for themselves. That's something that would be determined by a judge in court and is actually called competency and differs from capacity in that it is a global assessment that is not specific to a particular decision at a particular moment in time. But today we're just going to be asking the question, does this person have capacity to make the decision that their medical team is asking them to make? So how do we do that? There are four important factors that our patient needs to be able to demonstrate they can do in order for us to say they do have decisional capacity. And the first of those things is that they need to be able to communicate a clear and consistent choice free from coercion, meaning that they're not being influenced by somebody else for a different reason. So this is in many ways the most basic. An example of someone who may lack capacity because they can't communicate would be somebody who is comatose, for example. They can't communicate, they don't have decisional capacity. But that's not enough. Obviously, we need more. So the second thing our patient is going to need to demonstrate is that they have the ability to understand the information that is important for them to know in order to make this decision. And this is where it's dependent on their medical providers to teach them and share that information with them. So it's dependent on their medical providers to explain to them what the treatment that they're being offered is, what the risks and benefits of that treatment are, why that treatment is being recommended in the first place, and what the alternatives are to that particular treatment that they're recommending, if there's other types of treatment, or the option to not treat, and what the risks and benefits of each of those are. So a person needs to be able to understand all of that information in order to make an informed choice. But there can be situations where you may encounter somebody who can explain fluently everything there is to know about the risks and benefits of the treatments that have been explained. They can explain to you everything that they need to know about the illness and why those treatments have been recommended. But they may not understand that that applies to them. And so the third thing that the person needs to demonstrate is an appreciation of the situation that they're in and the relevance to them in that moment. So it is somebody, for example, who lacks insight into their illness may not think that they need to worry about it. And so may choose to reject a certain treatment because they lack the insight that they themselves may need that treatment. And that would mean that they lacked decisional capacity. And then the fourth thing that a person needs to be able to demonstrate in order to have capacity is they need to be able to show that they can rationally manipulate the information that they've demonstrated that they understand, the risks and benefits, the why of why they need this treatment, and use an internally consistent logical thought process to arrive at a conclusion. Now, that doesn't mean that I, as their doctor, agree with their conclusion, but they need to be able to show that there's some logic to how they took the information that we shared with them and then they arrived at the decision that they are making. So, for example, this is where somebody who is psychotic might lack decisional capacity because they may have delusional beliefs that are influencing their decision-making and interfering with that logical, internally consistent thought process that takes the information and arrives at a conclusion.